So we're going to talk a bit about Intracept. What it actually is basivertebral nerve ablation. Sounds like a mouthful, and it kind of is. There's a specialized nerve in the spine that comes through, and it actually comes through to the top, and it'll innervate the top of this end plate. You can see where I'm pointing here, as well as the lower end plate there. A lot of people, for years, we've treated discs with, say, epidural injections and treated the arthritic spine with radiofrequency ablation procedures, but we've kind of neglected to treat this cause of pain. We call it vertebrogenic pain. It's a very common cause, so as the disc starts to degenerate, the end plates that we talked about here on the bone will also become degenerative, which can cause pain. There's a nerve that sits in the center of that spine in the bone that will go to both the top and bottom of the end plate, and that sends a signal to your spinal cord, to your brain, that you have pain in your back. This actually targets that, and it's one of the first times we've been able to do that. And it's a novel new treatment that's been out now almost a decade, but only being done probably routinely for about the past 5 to 7 years. I've probably done more of these than anybody in the Northwest Ohio area at this point in time, and it's really nice to help those individuals with this kind of pain. It is an outpatient surgery, meaning you would have to have a driver come with you that day because you'll get a pretty deep anesthetic because you'll be essentially sleeping through this procedure so that we can numb up the skin. There'll be a small incision. It's probably about 1 centimeter in size. It doesn't even need any suture afterwards, just a little piece of what we call steri-strip to hold that closed. Barely can tell afterwards when we're done. We do under fluoroscopy guidance, meaning under x-ray, and we will access through the bone to get into that space where that nerve lives. Once we actually access that area, we will heat it up. We call it an ablation. That's where the basivertebral nerve lives, and by heating up that nerve, we can essentially ablate and destroy that nerve. The nice thing about this treatment, that nerve does not regenerate or regrow. It is not covered by a sheath of myelin, meaning it doesn't grow back. Whereas when we do some stuff for arthritis pain, that will tend to return in 6 months, maybe a year. This one has shown sustained benefit now upwards of 8 to 9 years for individuals and patients.